This morning here in London I gave a presentation about the prognostic models in patients with MPNs. And I focused on what are the current models that are being used in patients with the three main disorders that are polycythemia vera, essential thrombocythemia, and myelofibrosis. And I started by describing the models that are used in the clinical practice to predict thrombosis, that are the main complications in patients with PV and ET, and models that are being used to predict survival and also evolution in patients with myelofibrosis. These models are largely based on clinical characteristics of the patients, and they are useful for deciding about risk scores and also help doctors to decide to counseling about therapy, and particularly to counseling about stem cell transplantation in patients with myelofibrosis. But I also started to make the case that now we are moving from clinical-only scores to scores that integrate other variables that are biologic variables and especially molecular variables. After the description of the driver mutations in these disorders, we have started to learn how they might also be associated with endpoints in these disorders. For example, now we know that patients with ET who are JAK2 V617F mutated are at higher risk of thrombosis, and the opposite is true for patients who are karyotypically mutated. And particularly in myelofibrosis, we have identified a set of mutations that carry a worse outcome in these patients, and these mutations are now being integrated in combined scores for predicting survival. And these scores, again, might be useful for addressing patients to the stem cell transplantation procedure that is the only way to cure the disease but is still risky. And so we need to have a good idea of a balance between risk and goals for this kind of treatment. So I think this is an approach that is useful for patients, but we do not have to forget that these scores are for a general population of patients. And so what we still may lack is the prognostication for the individual that is just sitting in front of us. And of course, this might be improved, but at the end of the story, there is still a man and a woman in front of us.